A CT scan is reported as normal by AI. The patient is discharged. Hours later, he returns confused and vomiting. This time, the diagnosis is obvious: a subdural hematoma that was already there. Welcome to Clinical AI Academy Rounds, where we explore how artificial intelligence intersects with real clinical decision-making. Today's case is about a missed intracranial hemorrhage and what happens when clinicians trust AI more than their own judgment. A 78-year-old man on apixaban presents after a ground-level fall. He reports a mild headache but is neurologically intact with a GCS of 15. A non-contrast CT head is performed. The AI triage system reports no acute intracranial hemorrhage detected. The junior resident, reassured by the AI output and under time pressure, does not independently review the scan in detail. The patient is discharged. Several hours later, he returns, now confused, vomiting, clearly deteriorating. A repeat CT is performed. This time, a left-sided subdural hematoma is obvious, with interval enlargement. The supervising clinician reviews the initial scan. A thin, subtle hyperdense crescent, consistent with an early subdural hematoma, was already present. It wasn't absent, it was missed. Subdural hematomas appear on CT as crescent-shaped extra-axial collections. In elderly patients, especially those on anticoagulation, even minor trauma can cause bleeding due to stretched bridging veins. Early hematomas can be small and subtle, particularly along the convexities. And importantly, clinical risk remains high regardless of AI output. Current head injury guidance treats anticoagulated patients as high risk, requiring careful imaging review and reassessment if symptoms evolve. This case is not just about radiology, it's about automation bias, the tendency to accept AI outputs without sufficient scrutiny. AI triage tools are designed to assist detection, not to rule out disease. When clinicians treat a negative AI result as definitive, diagnostic errors become more likely. So here's the question: if the clinical risk is high, how much weight should a negative AI result really carry? Let me know how you would have handled this case. See you in the next round.